This is a brief introduction to the Health Identifiers service, My Health Record, and e-prescribing in the system. So the very first area that we want to look at, assuming that your system has been configured with the Health Identifiers service, we've set up some permissions, and we're basically ready to go. We want to look at the patient record first. So up here in the header, we can see Luke, our test patient, has this little indicator here saying My Health Record can't quite be found for them at the moment. We can see as well that Luke has what's known as an individual health identifier. This is a little bit like a Medicare number or DVA number. It's just a unique, stable identifier for that person returned by what's known as the Health Identifiers service. If we look down here in the Healthcare Identifier section, we can see just a little bit more of the details, whether the identifier is active, when it was last validated, and if we need to actually update or change, it would be pretty rare, but sometimes a patient might actually be able to provide you their IHA number. Alternatively, we can key in other information like a Medicare card, DVA details if they are on file, or as kind of a last resort, we can look up by some of the other details. We will either get a little bit of feedback on our search attempt, and we'll get, for example, that we can't find a match with these details. Or if it's successful, we'll see a success message. Now, generally, you will not have to use this lookup functionality, nor will you really have to take a look at any of the history here. What the system will do as you enter in, say, someone's Medicare details, and those are verified, the system will automatically start a search to work out what this number should be based on the information that you've provided. In 99.9% of cases, that's going to be successful. There's a few limited exceptions where perhaps someone does not have an IHI number, they've never been registered with Medicare or similar. Unfortunately, through the CareRight system, we don't support an onboarding or registration process. To access this area of the system, you require some permissions that your system administrator will set up around accessing the Healthcare Identifier service. And that, in short, is how healthcare identifiers behave in the system.